You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. We're talking about dental implants today, getting a brand new set of teeth in just one day. With us we have Dr. David Stubbs. Dr. Stubbs, welcome to the program.
Thanks for having me, Randy.
Now, I know you brought a stack of photos, and they're pretty dramatic, so we'll get to those, or as many of those as we can. But for people that don't know your practice, who's the typical patient and, for dental implants?
Well, it's two groups really, okay? So we have one group where they've been told by a dentist or they've been told somewhere that they're going to lose all their teeth. You know, they've already, they can't chew their food. They have teeth, but lots of cavities, gum disease, bad breath. You know, they're frustrated with their teeth.
Okay.
Root canal failed, fillings that have failed, crowns that have failed, and then
they come to you because they don't want dentures. Is that the main thing?
They don't want dentures.
Okay.
Yeah. And then we have another group that they're already wearing dentures. They're already in dentures. So they don't want those anymore.
Okay. So are there a lot of people in dentures?
Randy,
in Utah? I mean, it's known as such a healthy place.
Tens of thousands of people.
Really?
In Utah, yeah, in our area that are in dentures or in partial dentures. They've lost most of their teeth or just unhappy with their smile, unhappy with they're not able to chew, to eat food.
Now I know a couple of denture wearers. They never complain. Are you saying there's no such thing as a happy denture wearer?
Well, they're not going to tell you. You know, let me tell you about the life of a typical denture wearer. You know, they are so uncomfortable doing the typical things that we're used to doing. You know, they can't do water sports. You know, going outside to go out to eat. They're worried that they're going to lose their denture or that's going to be moving on them while they're talking and having a conversation. Sports like skiing. You know, they're afraid it's going to fall out. You know, they're going to lose it in the snow. You know, there's a lot of things. You know, just the fact that when they go to bed at night, you know, they have to take out their teeth, put it in a glass. You know, they're not going to complain about all those things to the average person. We are the ones who hear those complaints.
When I said at the top of the show that you can walk in with no teeth, like a denture, and walk out with a brand new set of teeth on the day of the procedure in one afternoon.
A natural set of teeth. You know, this is something that is bringing them back to where they were when they were in their 20s and 30s, but of course age appropriate. You know, you're going to get teeth that it fits them.
Are there a lot of people in Utah wearing dentures, like an upper lower denture or headed to dentures?
Tens of thousands of people. We see people many people a day that are in some type of denture, either full dentures or partial dentures or bridges, teeth that are failing, you know. But yes, when you say just dentures, yes.
Now, do you think the future of dentistry, whether it's, I don't know, 20 or 50 years from now, that means dentures as we know them today will not exist, they'll all be attached to something?
That's where it's going. That's where, I mean, dentures are so archaic. This was 200-300 years ago they had dentures. You know, you look at George Washington, even though it wasn't made of what it's made of today, had dentures. So it's something that is now at this point in time was ready. We have something now that's available that wasn't even available 20-30 years ago.
Okay, good. Now your center, I guess how dental implants are typically done, you go to one place for the imaging, another place where they do the surgery, and then another place where they put the teeth on top. You do it all right there. What's the big advantage aside from convenience?
Yeah, all in one house. Okay, so time savings for the patient. You think about, you know, having to make an appointment here, make an appointment there, coordinate those appointments. You know, going to and from the specialist and the general dentist, and so you have those issues with time. The second thing is cost savings. You know, if you think about you're paying this person, paying this person, paying this person. When we bring it all under one roof, we can save the patient significant savings.
You say that you're less than the big guys.
30 to 50% less.
Is that right?
That's what we've been told by our patients. These are patients that have come, they've gone to 2, 3, 4 different consultations at different offices. They come to us and say, oh my goodness, you just saved me tens of thousands of dollars.
So if you say there's tens of thousands of people in Utah that are wearing an upper lower denture, and then more than that, headed to a denture, why aren't they all coming in and getting implants? Like, what's your take on that?
Well, Randy, there's a few reasons. First, if you're a denture wearer, you've already lost all your teeth. You're out of the system. You don't need to go to a dentist anymore.
Good point. Okay.
Second reason is, you know, these people have spent hour after hour, appointment after appointment at the dentist. Failed root canals, failed crowns, failed all kinds of failed dentistry, and they're frustrated. And so once they were told by the dentist, hey, we need to remove all your teeth and put you in a denture, they didn't like it, but after they had the surgery done, after they had all their teeth removed and they're in a denture, even though they didn't like it, they were, I'm done. I don't have to worry about this
They don't
anymore.
want to go back in.
Yeah. So we don't see those people anymore. The third reason is they think they're too old. They think, why do I need this new set of teeth, that I can chew with? And
How old can you be to do this?
we've had patients do this into their 90s. They're into their
Why
90s.
would a 90-year-old want to do this?
Because they want to eat and chew.
Okay, good point. All right,
They want
obvious.
to be able to do things that they've always been able to do. That they could do when they were younger and had their teeth.
But are they more likely to have issues like falling out these implants if you're 90 years old?
No.
I mean, statistically?
No. In fact, we've found that the bone is actually much harder when you're older. And of course there's some exceptions to that, but we've found always going to be a 99% success rate in something like this. It's been always. If you think about orthopedics, where people get elbow surgeries or shoulder surgeries, those surgeries, that's a moving joint. People are moving with that new shoulder, that new knee, that new hip. With a tooth or with teeth, those aren't moving. That's a solid joint, easy for it to be maintained, a lot easier. You're not going to have the problems and the complications you have with those other kinds.
So you say 90-year-olds is not too old to do this. So 70, 80 is almost young to do this.
Yeah,
Is that right?
Yes, we had a lady come in the other day and asking the same questions, had the same concerns, and then
Like they're saying they're too old.
yeah, they're saying they're too old for this, or I don't know, doc, are you sure about this? And we reassured her, and now she said, I wish I'd have done it sooner. That was her only regret. She's chewing, she's eating food that she couldn't eat before. She's smiling, more confidence than she's had before. Complete change.
Is this one of those things where when it's all done, they say, I should have done this a long time ago?
I've never heard someone not regret it.
Okay. So isn't it true though, if you've been wearing a denture like 15 years, you can't do this? That means you don't have enough bone.
That's not true anymore.
Okay.
There's never been a patient that's come to our office and we had to say there's nothing we can do for him.
Okay.
There's so much technology with what we do now. We can put the implants in a day and get them teeth in a day, but even if there needs to be more surgeries or anything, we're still getting him into that solution and in that time frame.
Okay, good. Now, you brought some photos.
Yes.
What are we looking at here? Now, these are people that their option was a denture, and you gave them a brand new set of teeth supported by dental implants.
That's
Is that
right.
what these are?
That's right.
Okay.
You got it. Yep. So this gentleman came in. This gentleman was head for dentures.
Okay.
He had, lots of decay, missing teeth, and we said, no way, we're not doing that.
Okay.
We don't. That's not how we operate.
Now, by reputation, sorry to interrupt, but by reputation, are they coming in already saying, hey, I want new teeth supported by dental implants, or?
Depends. A lot of patients already know about us, so they do come in
Okay.
and they're asking for that. But some patients are just like, they've thrown their hands up in the air. They've been told, you need dentures. We can't do anything else. You don't have enough bone for implants, and we have to talk to them and look. We look at, of course, we have imaging maybe that the other doctor didn't have, or we have a different set of expertise that they didn't have. So we go in, we bring them in, and we do that full exam, that full checkup, and we're able to there hasn't been someone we haven't turned away.
So what did you do for him?
We removed his teeth and put implants in. So with him in one afternoon, he walked out with a brand new set of teeth that don't come out.
So how soon could he eat after it's all done?
So we're telling them to take it easy, for the first while, but before you know it, they're eating and they're chewing. We're talking broccoli, salads.
Raw broccoli?
Raw broccoli.
Okay.
They can chew into a juicy piece of steak, no problems.
Do they tell you eating stories? Do they ever come in and do they ever come in saying, hey, are you sure I can eat already, or I could start chewing?
It's funny. They've been so used to not being able to chew and not being able to tear into food that they're like, is it okay? It's almost a nervous reaction for them. But I've had patients where they go to take that first bite. They told me the story. They go and take that first bite and they start tears. They start crying.
Is that right?
Yeah, just from being able to do something they haven't been able to do for a long time. And these are natural things that we take for granted, Randy. Yeah, we don't think, gosh, what would it be like not to be able to chew our food? With him, he did something called IV sedation, where he was sedated for the whole procedure. He wakes up and is like, have you guys started yet?
Really?
And we're like, we're done.
Is it true they have like
And
almost amnesia?
This happens with a lot of patients. Yeah, a lot of patients have amnesia. They don't remember. Sometimes they don't remember until they're home. You know, a lot of the times they're waking up and they're coming to and they have their new smile, and you know that's when the family's celebrating. Usually I see, you know, since they're coming to, the family's reaction is almost more than the patient's reactions. The family are in tears. You know, spouse, children, you know, loved ones are there, you know, to see that patient.
It changes their appearance. You know, you told me that in the green room, that it's more than just teeth, but you could see, like this guy, he almost looks more successful.
Yeah.
It almost looks like he's had an easy life.
Yeah, look, if you look at him here, you know, look at his countenance. You see him before, and he's kind of unsure about his smile. You see him afterward, and you see someone who's got a full smile. He's confident in how he looks. He's confident in how he presents himself. Randy, this is our next patient, okay?
All right.
This is Lucinda. So she came to us because she did not want a denture. She had been in dentures for 7 years, and she was done with it. She wanted to be able to chew and to smile with confidence. And when I saw her the first time, and we took out her dentures and we looked at her, we were like, oh my goodness, she doesn't even realize what we can do for her. I was super excited.
Like you get excited.
Yeah,
could you see the end result?
Yeah, I can see it because we've done this so many times. So we could see. You can see the end from the beginning when you've done it enough times, as we have. So when she came in and she presented this, we talked to her about the things that she'll be able to accomplish with you know, putting 4 implants on the bottom jaw, putting 4 on the top at least.
To get a full arch of teeth on those.
Get a full arch of teeth, full function, front and back teeth, something that she hasn't had for a long time. And if you look at her now, look.
Wow.
You see.
Doesn't look like the same person.
It looks very different. You think, you know, almost like her daughter. We're talking about 10 years younger at least, you know, 10, 20 years younger. And she was one of those that, you know, she looked at it and you could tell, you know, she'd gotten compliments, and slowly that smile just came and rose, and it became a confident smile. If you look at this after picture.
Totally changes her appearance, right?
Totally.
And actually she looks prettier.
Yeah.
Just because of her teeth.
Well, they say this, science studies show that the smile is more attractive than a pout.
So when she sees it for the first time, what does she say?
I don't remember her, but patients get choked up. You know, if they're, you know, we talked about the sedation earlier.
Yeah.
If they're one of those that comes out a little bit faster and they're ready for, you know, they're awake for this part of it, they're smiling. They can't believe it. Something that they didn't even imagine. You know, a lot of times I always look at the family members though. I always, that's my favorite part, is because they've been waiting that afternoon for their family member, their loved one, to be done, and they're the ones who are all the way there. The patient usually the next day, or when we see them 2 days after for after their surgery, we always do a follow-up. That's when we get their good reaction. But yeah, it's amazing to see.
So what do they like more, the appearance or the fact they could eat whatever they want?
You know, it's interesting you asked that. So there's people that come in. Some people, there's, you know, 2 sides to this too. Some people are looking, they're saying, you know, I want to be able to chew. I want to be able to function like I did before, to you know, chew and eat. You know, I want to eat steak. I miss that. You know, a lot of these patients that are usually elderly or a lot of the men, they'll say that, okay? But then you have this other group of people that they just want it to look natural. They're worried about, that's their biggest concern. I want it to look nice. I want to be able to smile. I don't want people to be able to tell that I had something done either. I want this to look, you know, something's different about you. I can't quite put my finger on it, but something's different about you. And that's the reaction they want. Well, what we've found is when the person who wants to function, who wants to be able to chew and to tear their food, they just want to gum food or like a cow, like munch on, you know, soft foods, things like that. Those people start noticing, look, I can smile again. I haven't been able to do that. That looks pretty nice. That looks good.
Then they get a few compliments, and now they're smiling all over town.
10, 20, 30 compliments, you know, and then you start seeing that smile. You see the evolution of that as they come back for their visits. You know, all of a sudden they're having more conversation with the staff. They're talking to people with more confidence.
You see personality changes?
Big time. It's what they've been hiding for so long. You know, they've been holding back for all these years, or for whatever time they've been without their teeth, or in their condition that they've been in. So it's interesting to see that. Now on this other side, these people who want to look, They want that nice, natural looking smile, We're not talking, something that looks unnatural. We're talking about something that looks like theirs, but that's what they want. That's their goals. They start smiling, but all of a sudden they start to, they'll go out to eat, or they'll eat things that they haven't been able to eat in a long time. We're talking apples, raw broccoli we talked about earlier, carrots, lettuce with cucumbers.
So they initially wanted just the looks, and then they end up loving the fact that they could eat.
It's a surprise to both groups, because this accomplishes more than just one thing. People think, they ask me all the time, are you just doing this for cosmetic purposes? This is like a cosmetic dentist thing? And I say, absolutely not. This solves, and we haven't even talked about the health issues that people deal with, not just in their mouths, but all over, due to their body trying to fight the infection that's in their mouths.
So when you remove the teeth, now, I want to ask you about this. So if you have bad gums, like periodontal disease, can you still do this? Are your gums strong enough to hold the implants?
This is perfect, because if you think about it, it's not the gums holding the implants, it's the bone. So what we do is we clean up the gums, and we place these dental implants in healthy bone and healthy gums. It's a whole new set of teeth.
So the bad breath associated with gum disease, that goes away?
We're wiping all that out during this procedure.
Clean, fresh breath again.
Clean, fresh breath. So what our patients love about us, is we have our whole hygiene department dedicated to this. A lot of the big guys, they don't have anything like that. They send them to their dentist. So we're able to I always tell patients, once you do this procedure, we want to see you. We want to maintain it. It's like maintaining anything else.
Do they come back?
They come back every 6 months.
They actually enjoy coming to the dentist.
This is not your broken down teeth and gums that are in pain all the time. This is different. This is a whole new set it's healthy. So yeah, they're not having those same issues. So and a lot of times we're removing the bridge and cleaning it. So we're not even doing a cleaning in the mouth necessarily. So yeah.
And how long could they last? I mean, they're billed as permanent. I mean, they could last as long as you take care of them, just like regular teeth. They could last as long as you live.
Implants are meant to last the rest of your life. If they're maintained properly, and that's what I always tell patients. If they're maintained, now there's things that can happen if you're not maintaining your teeth. Just like the teeth, you can get inflammation and things like that. So that's the big reason why we have our hygiene program.
So just keep them clean. Now in Utah, we had this discussion. People are very loyal to their dentist, right? And you were mentioning you don't have to switch dentists. That means they could go to you for the implants and then stay with their dentist.
That's exactly right.
Is that right?
As long as their dentist is comfortable and equipped to maintain and clean these teeth, we suggest that. If you already have a relationship, if it's closer to home, go ahead and do that. We just want to make sure that they're going to be getting maintained every 6 months, at least twice a year.
People travel all over Utah, from what I understand, to see you.
Even out of state. Yeah,
really?
We get people from out of state, from other side of the country, who find us for one reason or another. And so yeah, we feel very grateful that people found us and try us out.
So are more women doing this than men? Because I guess men put things off till they can't take it anymore. The pain is so bad, right?
Dental procedures are these issues that people have. There's no respecter of persons. Everyone has these type of issues, but usually, yes, it's the wives bringing their husbands in, and
Really?
they're dragging them in, saying, "You need to get this done. You need to at least see what they can do."
Because they're nagging about their teeth all the time.
But we've also had couples that are they've been together, they've had issues, both of them, and they come in and do it together. We've had
good.
more than a few of those cases. Yeah.
Okay, good. Time for a couple more photos.
Yeah, let's take a look. This gentleman actually had some health issues and lost a lot of his teeth and had a lot of issues due to these health issues. And we find that happens a lot. Meaning, you get medications, dries your mouth out. You start losing your teeth, you start getting decay because all your natural body's defenses aren't there anymore. So what we're able to do here, he was worried about going to dentures. He found us. We were able to get him new teeth in a day, fixed teeth.
Look at that. Looks good.
Here's the next one. Again, same type of deal. Just look at him before and after. I mean, if you look at the before,
he's smiling big at that after,
and you look at the smile after. Look at how the smile changed. And that wasn't even his primary concern. His primary concern was, like we talked about earlier, was being able to chew, being able to tear into food, being able to eat the foods that you're supposed to be able to eat. Okay. Again, partial denture. This
Wow.
gentleman had, and of course he had some teeth as a partial, but those weren't attached, and he wanted a full set of attached teeth. And this was the big thing for him. I want to be able to
That's
chew
too young to be wearing
in
dentures.
the
this guy.
front. Yeah, young guy. If you look at him before and after, I mean, look how much younger he looks with it. Look
Yeah.
how much, and I always say this, look how much more trustworthy. You think you can imagine
It's a good point.
doing a job interview for the first guy and the second guy. You know, you look at the difference. You know, who you're going to trust more in that
Good
situation.
point.
So,
You know, we talked about Hollywood.
yeah.
That in the movies, if you want to make somebody look dirty or poor, you give them bad teeth.
Yeah.
There's like a bit of a stigma.
Yeah, look at Halloween. What do people do when they want to make themselves look scary?
Or dumb.
They'll color a tooth in. Or
Yeah,
dumb.
yeah,
or
yeah.
something. Yeah. So that you think about it, that's our smile dictates a lot of how we look, how we present ourselves in a lot of those ways. So let me look at the next one here. Again,
right.
teeth that are failing. We're talking gum disease. We're talking, you can't, we're told that, hey, you're not going to be able to keep your teeth for much longer. Let's try to do cleanings every 3 months if we can, but there's still the prognosis or the future outcome doesn't look great. So he comes to us like, I just want something solid. I don't want something that the teeth that wiggle and move. So that's what we were able to provide for him. Look at, before and after. Better
So this
smile.
is done
in a natural smile
So
too.
if everything works out, like in just a few visits, they can get a brand new set of teeth. Like somebody watching this right now with a denture.
Yeah.
Next month they could have new teeth that don't come out.
Less than a month, yeah. So what they do, they come in and they, there's a couple before appointments, consultations, but we're talking one day. They're not a day without their teeth. They're one day that they're coming in the morning, they're leaving with a new set of teeth. Those are, and a lot of these pictures, if you look at the before and afters, these are same day pictures. This is 8 o'clock in the morning, 9 o'clock in the morning, 4 or 5 o'clock in the afternoon, in the evening, early evening.
That's
time.
all done.
All done.
Do you ever run into people like at the grocery store around town? They say, Doc.
It's become more and more. Yeah, over the years, it's become more and more. And they're like, oh my gosh, it's either them or a spouse that they'll come and stop me and like, I'm so grateful you did for my wife or my husband.
Oh, good.
Honestly, that's a big part of the satisfaction I get from doing this is seeing them go through the process, seeing those changes, but then afterward following up and seeing how they're doing now. It's great to see that. We're not talking about same day. Now we're talking about years later. Year, 2, 3 years later, and just to see that.
So no more
they are now.
dentures.
No more dentures. They're doing great. This feels great.
Okay, good. I'm going to rush you because I know you have more photos.
Yeah.
But it's good. It's good.
Again, look at the missing teeth. Look at the other teeth that were there. Those teeth that are existing, that are there now in his mouth. Those don't have any life left in them. We're talking about basically a hopeless situation as far as what he has.
So he would have been in dentures.
Would have been in dentures, and a lot of patients, like I said, we want to see those denture wearers because we can almost do more for them than we can with people that still have some teeth to chew with and bite in with. But even then, there's a lot. You're going to see this next one. There's a lot of change and a lot of things we can accomplish, not just with their appearance, but we're talking about how they do day-to-day things that we take for granted all the time. This is a girl very self-conscious about her smile. And I still remember the day she came in. But look at her now. Look how she smiles with confidence now. Look at the change between those two.
Yeah, pretty smile. So you're in on the design, like to make these look real? Because
We do.
I told you
we have a team of experts, and I have. Go ahead. What were you going to say?
No, but I told you over there. I said I feel like I could spot fake teeth walking down the street, and I think you said no, not mine.
Yeah,
they look real.
Our goal is that patients can't tell. So this gentleman, he had gum disease, bacterial infection, missing teeth, and after the surgery, he told us all this pain I had in my body, I had aches and pains, they all went away. And I'm not saying that happens to every patient, but for his case, he said all these health issues that I've had, and the doctor's been telling me, oh, take this pill, it'll make it feel better. Take this pill, it'll make it feel better. And nothing was working. He got this taken care of, his mouth and his gums taken care of, and he said, I'm a new man.
It's interesting you say that. We've had medical doctors on the show from the Institute of Functional Medicine, and they're now recognizing that gum disease, this bacterial infection, has an immune response. Yes. And when you get rid of the bacterial infection, people have more energy.
Yeah, it's suppressed. If you think about it, it's walling off all that infection, and now you've taken out that source of infection, and now the immune system doesn't have to work as hard.
Have to deal with it.
Yeah.
Okay, time for a couple more.
Okay.
Very nice.
Again,
sorry to rush you here.
No, it's okay. You look at the before and after there. You see.
She was going to have dentures?
She was losing her teeth. She was in pain in a lot of her teeth, and she had decay in all of her teeth. So with her health issues and things going on, she was heading that direction. And that's our goal. You know, honestly, our goal isn't to say, this is what you have to do. We paint a picture. Like, we can save your teeth and do this, but with your health issues, with, you know, lack of saliva, things we talked about earlier, you know, 10, 20 years, you're gonna have to get those replaced and replaced again, and replace a tooth at a time, tooth here and tooth there. So we can do that route or do it in one day and get your third set of teeth.
Because you said not everyone needs dental implants.
No, we do makeover smiles where they're getting, you know, they're getting new teeth, or, you know, we're talking about veneers and crowns, things like that, and we can enhance their smile, make it look naturally better. But again, it all comes down to their health. It comes down to what are they going to be dealing with. We don't want to give them a fix that's going to last for 5 years, 10 years. We want something that's going to last them the rest of their life. Do I have permission for 2 more?
Okay, 2
please?
more.
Okay, let's look at this one right here. The interesting thing about this girl is when she came to and she woke up with her new set of teeth, I can't repeat what she said on TV. She was so excited. Yeah.
Good. No more dentures. All right.
No more dentures,
So final one.
So this gentleman, again, underweight, couldn't eat his food, couldn't break it down. He had to eat only certain things, losing weight. I saw him a year later.
So you gave him a brand new set of teeth supported by dental implants.
We gave him a brand new set of teeth supported by dental implants. We're talking a year later, he's gained 40 pounds. He's engaged to be married.
So he's normal weight now.
He's since been married, yeah. He has all that confidence back. But this one was a special one. Yeah, he really, if you see it, like how he was before and then afterward, how excited he was and how happy he was, and just, again, like I talked about earlier, their whole countenance just changed, and how much they're able to live life, things that we take for granted all the time.
We're out of time. So final message, somebody watching this, either they're headed to a denture or they're currently wearing a denture, they've heard what you had to say, but they're still scared, or maybe even skeptical. What do you say to them?
I invite them in. I just say, come in, we'll do a free consultation. We'll go over everything, medical history. We'll talk about all their needs, all what they want to accomplish. That's my first question is, what are your goals? Okay. And we'll go through that, and we can accomplish all these goals, and probably more, like we talked about earlier, than they think they're going to have.
More than exceed their expectations.
Exceed their expectations, accomplish more than they think they're going to be able to accomplish.
Now we have to mention this because we get emails about this. Medicare, Medicaid does not cover dental implants. Even the best dental insurance only covers a very small portion. So what's the answer? Financing.
If you think about it, we have patients financing this every day. We can keep this to a low monthly payment, and it doesn't affect their lifestyle.
You have to have decent credit because you're not carrying
of course, you have to have decent credit. We're not talking about 800 credit score or anything like that, but they just have to be able to. Most people do qualify. So
okay, good. So every day people are financing this.
Every day.
So there's no more excuses.
No more excuses.
And you have sedation, so they don't even have to.
They don't remember things, or most cases they don't remember anything. Yeah.
Okay, good. I want to thank you for coming to the show. Good stuff.
Thanks. Thank you.
And it's a free consultation. Do they get to see you? Because I know you have a big team.
They do. So if they request me, they will be able to see me.
Okay, good. Thanks again.
Thank you.
Good stuff. You've been watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.